So after surgery, patients are definitely going to be on medications to help with all the different things that they have to go through. Before surgery, I always ask you to make sure you pick up medications. For the most part, we usually send those 1 to 2 days before surgery, so that way we can make sure that they haven't gotten lost. We can also make sure patients are ready to go through surgery. We don't want to give out narcotics if somebody's not ready for the surgery yet. But once we get the medications, look at those medications and start to organize them. A lot of my patients joke they feel like a pharmacy when they leave, because sometimes you'll get up to 10 different medications, but they all serve a different purpose. And many of these medications, a lot you may not take, and that's okay. But what I want to have happen is I want you to have all the meds available. So that way, if you need something, you're not trying to get a hold of us on a weekend, you're not trying to run to a pharmacy in the middle of the night and they're closed or they don't have the right meds. So we're really trying to avoid all those problems. In general, I'll run through the categories of medications that we will give for most of the surgeries. First one's going to be an anti-inflammatory. Anti-inflammatory is designed for pain and swelling. The one I write most commonly would be naproxen, but there are some others. The reason I like it is only twice a day, so usually with breakfast and dinner. This one is going to be a mainstay during the entire recovery for most replacement patients and fracture patients. It's going to help keep the pain down, but because it's solving a couple of problems, it's keeping the inflammation down, it's keeping the swelling down. This one is only going to be avoided if it's giving you a lot of GI upset, so if it's giving you an irritated stomach, that would be one to stay away from. Or if you have kidney problems, or obviously for any of these medications, this is true, if you have an allergy to a medication, just set it off to the side. We're going to try to avoid those. The second one that I give frequently would be gabapentin. Gabapentin is a nerve medication. Again, it's not a narcotic. This one is typically 3 times a day, and it's good for nerve type pain, so sharp shooting pains, sometimes tingling. Helps for a lot of my patients will get like some sciatica coming from the back as part of the rehab and things like that. This pain actually usually gets worse between 4 to 6 weeks from the surgery, so by starting it early, it kind of helps keep us away from that, and occasionally we'll have to go up on that medication. If it's bothering you from any other side effects, again, please stop this one. Things that commonly are reported is sometimes it'll make folks sleepy, a little loopy, anything of that nature, again, set it off to the side. Next category would be narcotics. There's 2 main ones that I typically give, Tramadol and then Tylenol with codeine. Tramadol, it usually is less sedating, meaning it makes people less tired. So a lot of folks will use that one during the daytime. The codeine is really good for sleep, but the downside is it has a lot more side effects in terms of constipation, nausea. It can affect people's balance sometimes. So again, you want to be really cautious when taking these medications. I typically recommend try to stay on one or the other. You can take both, but don't do that the first time. That's only if you feel like one or the other's not enough on its own, and then you can combine those. For patients who are having really severe pain, make sure you will follow the label, but you can go up on the dosage of those, but only within safe levels. So again, follow your pill bottle and the pharmacy recommendations. On these medications, once you get away from the severe pain, these are the first ones you can also stop. But typically you'll still need them, especially before therapy. Some patients won't take the narcotics and they'll say, "Doc, I don't need those." And I'll look at their knee and they've got no motion in it. And I'm like, "Why aren't you bending your knee?" They'll say, "Well, whenever I bend it, it hurts." I'm like, "That's what the medication's for." So please use the narcotics when you need it, so that way you can do your rehab, you can do your motion, all of those things. Just know they do have side effects. Aspirin is the most common blood thinner that we'll use nowadays. Blood thinner, typically we take it twice a day. It's an adult strength aspirin, and we take that for the first 4 weeks. That's in combination of using your leg squeezers, otherwise known as SCDs, and your compression socks. As long as if the compression socks are giving you skin ulcers, if you can't get them on, if it's rolling, things like that, don't use them. We don't want it to create a problem. But swelling is common for everyone. So make sure you're using all those things, because again, what we're trying to avoid is a blood clot. And the aspirin will continue for that first 4 weeks unless we recommended something different. The next medications are all really designed for the possible side effects or the different things that can come up as adverse reactions from the surgery or from other medications. One of those is Docusate, which is a stool softener. Like I said, with codeine, everybody gets constipated. So we usually start you on the stool softener. If you're getting loose stools, if it's giving you too many side effects from having too many bowel movements, then certainly stop it. It's not something you have to take in that scenario. For some patients, it's not enough. So there's a lot of over-the-counter options if you're getting constipated from the codeine, things like Miralax. Talk to the pharmacist and they can definitely talk you through some of those options. The next category would be anti-infection, so an antibiotic. A lot of my folks, I'll prescribe something if they're in the high-risk status or we're doing it as an outpatient. And again, this isn't because there is an infection, it's because we're trying to prevent an infection. So if we do send you an antibiotic, as long as it's not giving you any side effects, please take that until the pill bottle is complete. The next category would be something for heartburn. A lot of times I'll give omeprazole. Like we talked about with Nexium, with naproxen or any of the anti-inflammatories, frequently you get some upset stomach, and the omeprazole helps reduce the heartburn or the reflux associated with that. Most folks need that the first couple of weeks because you're laying down a little bit more, and that's a tendency to have a little bit more of the reflux. Next medication, typically it's Zofran, also called ondansetron. This one's for nausea, especially for the first couple of days. Very common to have a lot of nausea, and this one will help knock that down. If you do need a refill, please let us know, not a big deal, but it's highly effective. And then the next category is going to be usually a muscle relaxer. Muscle relaxers, typically the most useful part of that is going to be sleep. It is pretty sedating, but it can help with muscle spasticity if you're getting a lot of cramping, Charlie horses, in addition to the things you would already think of like hydration, electrolytes. The muscle spasm medication would be useful for those. So I know that's a lot of medication that you're going to have on your bookshelf there next to your bed, and it can be daunting, and that's where family members can be really helpful in terms of organizing. For some of my patients, they'll end up needing everything. Some of my patients may need almost none of it or only for a few days. Nobody's wrong, and that's why I don't write out like one thing for everybody to take, because everybody's different. So you've got to make sure you do what your body's doing right and know your own body. I trust patients to make those decisions and to use the information we give to figure out how best to accommodate their post-operative needs. But refer back to this video, refer to the list that we give you, make sure that you feel like you're comfortable with those. And whenever you run into problems, please send us a message so that way we can try to help the best we can. Use your home health nurses. They're very good at answering questions with regards to medications as well. And then if push comes to shove and we get into an emergency scenario, please don't sit at home with a major issue. Come to the hospital so that way it can be evaluated.